Well, so thank you so much. A very good evening, everyone, and very good night from Bangladesh. Thank you so much, those who are joining from Kenya. So, welcome to Kambaii Presents, Kambaii Healthcare Advocacy in Kenya. So, today's world right now in a healthcare perspectives, we wanted to discuss about with the Kenyan people, where we dive deep into the heartbeat of Kenya's healthcare system through the eyes of its vibrant and insightful young generation. So this is Dr. Hossain Al-Amin. I would like to moderating the session. And today we have the privilege of hosting a panel of dynamic individuals who represent the diverse voices and experiences of Kenya's youth. Together, we'll explore the pressing challenges, innovative solutions, and hopeful aspirations for the healthcare in Kenya. So please sit back, tune in, and let's embark on this enlightening journey together. So in the guest panels, we have Mr. Nijugana Alvin, he is the finalist of BSc Medical Lab Sciences, Murang's University of Technology. He also the Director of External Affairs, Africa Federation of Medical Laboratory Student Association, founder and president of Murang's University of Technology, Medical Laboratory Student Association, and executive member of Kambaii. We have Mr. Derek Oma. He is the finalist medical laboratory scientist at Canada University, and he has an experiences in medical laboratory from industrial hospital attachment in the curriculum, and he has served as a chairperson and one of the pioneers of Canada University Medical Sciences Research Society, a research organization based in Canada University, served as the Secretary General for Association of Canada University Medical Laboratory Science for a period of 7 months. We have Mr. Wang Liam Morsi. He is the president of Kenya Medical Laboratory Student Association. He is the committee member of African Federation of Medical Laboratory Student Association and organizing secretary of Medical Laboratory Student Association, MKU. And we have Lazario Caterico, BSc Clinical Medicine, Egerton University, Kenya, and he is the member of International Federation of Physician Assistants, outgoing secretary for Counselors Club Egerton. And finally, we have Mr. Nelson, is a finalist of BSc Microbiology at Kisii University, Kisii, Kenya, and wanted to the graduate in December 2024 with a strong interest in public health, AMR, and the global health. Currently, he is a member of Kenya Institute of the Public Policy Research and Analysis and mentorship program for universities, Stanford Development USA, and Kisii University Pure and Applied Sciences Association. So thank you so much, everyone who has joined the session. Thank you so much from Kambaii, and thank you so much from Bangladesh, as I am right now representing Bangladesh from my side. So welcome, Mr. Nelson, and welcome, Derek, and welcome, Henry. So how are you guys today?
We're doing good. We're doing good. Kenya is fine.
Yeah. Okay. So what about Derek? Mr. Derek, all good from your side?
Hello. Hey. Oh,
Yes.
how are you?
Yeah, I'm fine. And what about you? You are good?
Yeah, I'm okay. I'm good. Yeah, Kenya is also okay.
Okay. So we have Mr. Henry. So Henry, how are you?
I'm very fine. I'm very fine. Sorry for that. I think I've lost power output. I think there's a problem. But here I'm fine. I'll be joining you shortly. So I'm sorting about my visibility so that I do not depend more on electricity.
Yep.
Thank you very much. Otherwise, I'm very
Thank you so much, Henry. So yeah, so I'd like to go to you later on. So I just move forward to Mr. Nelson. So Nelson, this is not an tough webinars. We wanted to discuss basically the main mission and vision of today's sessions is we wanted to know about the Kenya's healthcare systems and how young generation can provide their approaches and what is their roles and responsibilities and how they can help to improve the healthcare system, especially in the Africa. And I would like to prefer on the specific question, especially in the Kenya. So can you provide right now your healthcare system in Kenya, so how it has happening in the government level or non-government level? You would like to just describe about your healthcare system in Kenya, Mr. Nelson.
Okay, thank you so much, Dr. Hossain, for that question. I think today we're having a privilege to talk about something that is very key in every country, that is health. We all know that health is a fundamental human right and is among the SDGs 15. Here in Kenya, I can say for so many years, Kenya has been experiencing a lot of challenges when it comes to health. Issues about health insurance, issues about poor health services, lack of services to those in remote areas. Those are some of the challenges that are currently affecting Kenya. And just recently, the government disbanded the National Health Insurance Fund, the so-called NHIF, that has been in place for 57 years. However, it failed to provide health insurance for the people. So they replaced the insurance with what we call the Social Health Authority, which aims to rectify all the challenges that NHIF failed to accomplish. Also, I want to say that healthcare in Kenya, we are yet to achieve universal health coverage. We know that universal means affordability. Everyone should be able to receive healthcare services without having to get into financial distress. And so in Kenya, the cost of healthcare is quite expensive and is not affordable as the way it should be. We're still in the journey of striving to accomplish universal health coverage. I believe that the newly formed Social Health Authority, which includes the Social Health Insurance Fund, SHIF, is one way where the government will implement the universal health coverage, whereby everyone, both in the public and informal sector, will be able to achieve and receive healthcare services whenever they want.
Well, so thank you so much, Nelson. So I'd like to move to Mr. Derek Oma. Derek, can you hear me?
Yeah, sure.
Well, I have a little bit questions to you. That can you please mentioning about the curriculum? Let's say the medical curriculum system of your country. How many medical colleges are there? It means the government medical college. How many private medical college, and how many medical graduates are you are producing per year? Can you mentioning about the medical college number of medical college?
Oh, okay, thank you. So, first of all, actually, in Kenya, we have we have around 9 universities offering medicine and surgery. Yeah, and then that's at degree level. Yeah, and then apart from that, now from my specialty, now where I chip in, yeah, medical lab. Yeah, there are quite a number, of course, yeah, from ranging from degree program to diploma, yeah, all the way, yeah. And basically, uh, annually we produce from medical lab. Actually, we produce like Kenyatta University alone. I can confirm that on an annual level we produce more than 30, yeah, medical lab only. That's Kenyatta University degree. Translating this actually to Kenyan level, now where we have various actually medical lab course, yeah, that's our market actually is more of a diploma from the previously, but medical lab degree was introduced in 2006, and we have been seeing currently rising number, yeah, from graduates of degree in medical lab. So we have roughly like, I'll just do an estimate, yeah, of medical lab. We have around let me estimate to around just barely. Let me say on an upper scale. Let me give it around 1,000 graduates, yeah, annually from various levels, degree, diploma, yeah, and even postgraduate students. That's a masters and uh, even PhD, yeah.
Well,
So and
Derek, can you provide me the answer that? So, what about your post graduation degree in your medical sectors? Let's say, after MD or something else. What about your post graduation medical degree in your country? Any idea about your post graduation degree in
okay,
Kenya?
yeah. For postgraduates, it's not that high. I'll give it a scale of let me be specific with KU. I'll give it around 30, yeah, annually. That's roughly rough estimation on an annual level, yeah. So though it's not that high, yeah, for postgraduates on medical lab. alone, yeah, we have like, let me estimate around 500. Let me give it like 500, yeah, on an upper scale.
Well, so thank you so much. I will get back to you. So I just go to Mr. Modi. Modi, can you hear me? Maury.
Yes, I can hear you.
Okay, can you please turn on your camera so that people can see you? Maury. Yeah, perfect. Well, thank you so much, Maury, for joining with us. I have a little bit questions to you that you are the young generation leader. So what are the basic challenges you are facing in your healthcare system in Kenya? Can you please enlighten us regarding to discuss openly what are the basic challenges in your healthcare system?
Okay, thank you so much, Dr. Hossain, for giving me this chance. I'm Wangila Morris, an undergraduate student from Mount Kenya University, level 3, taking Bachelor of Medical Laboratory Sciences. I'm the current president of Kenya Medical Lab Students Association. So that means that I'm in charge of all the medical laboratory students in Kenya. And I'm a committee member of the Standing Committee on Research Exchange in Africa, Federation of Medical Laboratory Students Association. Actually, in Kenya, the healthcare system, let me say, is relative, is not so well developed so much. And some of the challenges that actually we are facing here in Kenya is there is so much limited access to quality healthcare services, especially in rural areas. And we also have high costs of healthcare. There is high cost of healthcare provision in our country. We also have matters with corruption. For one to actually get being access to these services, there's a lot of corruption that usually takes place, like in our country. Another thing is about infrastructure. The infrastructural development, especially in rural areas in our country, is not so much well developed. So this provides it hard for 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 attaining these healthcare services for those people living in rural areas. So inadequate infrastructural development, and also matters to do with public education. There is inadequate and insufficient health education among the members, mostly in rural. Let me specifically be focused on marginalized communities in rural areas. So there is inadequate education, and inadequate and inefficient. So the effectiveness of the education system in rural areas and in some parts of urban areas, especially the slums, is not so well developed. So actually, those are some of the main challenges that actually I've been able to see, and I've also gathered during my recent studies and research among the healthcare system in the country. Thank you so much. Yeah.
Well, thank you, Maury. I have another questions to you. You were mentioning there is the lot of the health cost during the time of if any of the patient taking the services from the Kenyan healthcare. So why? What are the causes? Why this is a expensive healthcare system in Kenya?
Sorry.
Why your
Can you,
healthcare services is very expensive? Any idea?
why the healthcare system is very expensive?
Yeah.
Okay.
Any idea?
Okay.
Is it due to the? I just make it very easy to you. Is it due to the let's say the limited resources, some extent, weak infrastructures, some extent your GDP is low, right? So I think Nelson will answer the question. Well, Nelson, you just provide the answer. Yeah.
Okay.
Okay.
I think the main problem I think is due to limited resources, and also the medical let me say medical equipment, they are so expensive to get them. So this makes the healthcare delivery so much expensive. Yeah, thank you so much.
Well, Nelson, can you please input from your end? Any input?
Okay. I just want to take another tangent that is usually overlooked, but is very key on why healthcare in Kenya is very expensive. You see, the previously disbanded NHIF had been there for like 57 years here in Kenya. And NHIF was unable to incorporate people in the informal sector. And when you look at the demographic statistics of Kenya, around 83%, according to a 2020 report study, belong to the informal sector. The NHIF was mandatory for people in the public sector, the formal sector. They used to contribute 500 shillings monthly. And so people in the informal sector, they only had the voluntary option to contribute premiums to the insurance. This means that when the time comes when these people are getting sick, they don't have enough funds in the insurance to pay for access of healthcare. So that was a very huge challenge, meaning that within time, after let's say 1 month, people from the informal sector, because they're irregular and they're unreliable because of their income salary, they tend to vary. They don't contribute the premiums on a like let's say consistently compared to someone in the formal sector. SHIF, which has recently been introduced by the government, is set to rectify this issue.
Well, thank you so much, Nelson. So I just moved to right now in Hanson. So Hanson, can you hear me? Can you please turn on your camera? Mr. Hanson?
Yes, yes, I can hear you very well. Thank
Oh,
you.
well, so thank you so much for joining with us. So I would like to request to everyone to open on your camera so that we can see each of everybody, right? So that the discussion will be more fruitful. Elvin, can you please turn on your camera? Well, so Mr. Hanson, so my questions to you, can you please enlighten us to share about the public health perspective on your country? Because this is a developing country, and you know about the public health is very important, especially preventive approaches. So can you tell me right now what is your public health status on your country, especially the preventive approaches of the disease or something else?
Okay, so what I can say in Kenya, one of the things that faces us and is an issue, we have the accessibility, we have affordability, we have things like the quality concerns, government efforts, the community health workers, yeah, such stuff. And starting with the affordability, you know, many Kenyans, they perceive healthcare as an expensive and inaccessible. The cost of medical services, medications, and insurance premiums, they can be prohibitive for a significant portion of the population. And you see, as a result, people often delay seeking medical attention or opt for the traditional remedies, which are you can't rely on the human body. You can't wholly depend on the traditional things that in the African countries that we normally did in the previous times. And for the quality concerns, we have you see the public hospitals and the clinics, they face challenges related to infrastructure, as my brother Maurice has just stated. And you know, we have issues even like staffing and equipment. You see, you find patients sometimes they encounter long wait. They wait for a long time in line for them to get attended to. We have facilities. We don't have so much facilities that are up to par with the other modern worlds, with the current standards of the modern times. And this it impacts generally overall the perception of the healthcare quality in our country. And another thing that I can add on, we have these issues of the health insurance. We lack a widespread health insurance coverage that remains a significant issue in this country, and only a small percentage of Kenyans have health insurance, that are leaving many vulnerable to high out of pocket expenses. Thank you.
Oh, so okay. Thank you so much, Mr. Hanson, for your nice input. So I would like to go to Mr. Alvin. So Alvin, can you hear me? Can you please turn on your camera? Mr. Alvin. Alvin, can you hear us? Well, I think Alvin is mute right now. So I'd like to go for is Mr. Derek Homa. Derek, I have a questions to you. Can you please provide us about the healthcare innovation, right? So what are the technology you are using right now in your healthcare system? Let's say, is there any uses of electronic medical record systems or EHR or EMR? Is there any? Can you please provide us that information?
Yeah, okay, thank you. So at the moment, yeah, in our healthcare systems, actually the current technology we've been using, of course, we adopted a digital system, yeah, now where uh, most hospitals, actually at least I've witnessed quite a number of hospitals have abandoned uh, previous manual systems, and then they have integrated systems to facilitate easy communication between different departments within the hospitals. Yeah, as well as currently, I think of late at KUTRH, that's Kenyatta University, the training, teaching, and training research hospital. Yeah, they had actually acquired there was a machine for cancer screening. Yeah, and they are trying to adopt a new way in which they can at least be able to handle current some burdens of of illnesses like cancer. We've witnessed, most patients, are being referred to at least I can say India for further treatment because of lack of, medical equipment. So at least I can say KUTRH, that's Kenyatta University, teaching and training, okay, teaching and research referral hospital, yeah, has acquired those machines. And then there's also another one that was acquired at Kenyatta National Hospital. That was some years back, also for cancer therapies. Yeah, at least I can say at least in terms of digitization. Yeah, we are trying. Yeah, though the pace is so slow because of the resources, of course, the financial resources and the equipment are quite expensive. But from my perspective, we are gradually improving. Yeah, there's a gradual improvement digital wise. Yeah, at least. And then
Well, yeah, yeah,
there's also another
yeah. Please
one.
continue. Yeah.
From from my previous, I have a friend who actually uh, dwells so much, in medtech. Yeah, so he's from him. They were trying to integrate a system, where they can at least some digitization in healthcare, where now, at least I can offer consultation through online modes, yeah, rather than physical. So because of difference in distances and all those, yeah, thank you.
Well, thank you so much, Mr. Derek. I will back to you very soon. I'd like to go for Mr. Nelson. So, Nelson, can you please mention to me about which disease is endemic from your side, or which is a very common diseases are present in your community?
Yeah, thank you for that question. Here in Kenya, we currently are still battling with malaria. It's a very, very, very common disease here in Kenya. But thanks to the progress and support from global institutions, ALMA, we're trying as much as possible to roll out the R the Mosquirix vaccine, especially to children and those who are much needed. Because as you all know, especially African countries, we tend to be impacted with infectious diseases compared to European countries where we have lifestyle diseases and communicable diseases like diabetes and the rest. Here in Kenya, we are battling with malaria. other disease I can say we are still battling with, I say polio. We are still doing immunization for kids. No, is there another disease?
Well, so what are the common lab investigations you have done, and which is very common? Serology or X-ray or something else. What are the common investigation that has done in your healthcare system?
Okay, what I've been doing as a research intern at National Influenza Center, where I was doing diagnosis of influenza virus, influenza A and influenza B in Kenya. And I can say that the diagnosis and the number of cases were very, very high, especially in some areas. I can mention we have Turkana, we have there's a refugee camp called Kakuma. We used to receive samples from there. Then we do a diagnosis, and I could notice the refugee camp, we could see lots of cases of influenza. Also doing COVID-19 diagnosis and surveillance at National Influenza Center. I noticed a number of cases here in Kenya still, but they were not that severe.
Well, thank you so much, Nelson. So, Alvin, right now you are hearing with us. Can you please turn on your camera, Alvin? Uh, Alvin, I think Alvin is somehow not responding. Okay, so don't worry. So yeah, Alvin, can you hear us?
Yes, I can hear you, but right now I'm traveling, so I don't think I can talk
Okay,
much.
okay. So you just mute it. Okay, that's fine. Well, I just back to the Hanson again. So, Mr. Hanson, so I wanted to know about the uh, future of research and development in your country. What do you think? Is there any kind of the opportunities there for research and extensive research and some policy making or something else? What do you think?
Okay, yeah, thank you so much. Okay, so one of the things in terms of research and development in my country, we have one things like the Kenyans Vision 2030, where Kenyans are in relation with the AU agenda of the 2063, they recognize the critical role of scientific and the scientific organizations in achieving development objectives. We also have the Kenyan government, which is actively it collaborates with the scientific and research organizations so as to drive development. We also have, in terms of data science and innovation, Kenya has a rapid progress in research and data science positions. It is a regional hub for innovation and technology in Eastern and Central Africa. Yeah, and the investments in education, yeah, that's a thing, that's a big thing that's going on in Kenya, and it's driving the tech ecosystem, and it's addressing the social challenges that contribute to Kenya's potential in data-driven solutions. So in summary, Kenya recognizes the importance of science and innovations in its development journey, and by fostering the scientific talent and investing in like the R&D, Kenya aims to achieve prosperity and address the pressing challenges that we currently face at the moment. Thank you.
Well, thank you. Hanson, I have another questions to you. Let's say in a research, development, or something else, we need a capacity building training. So if we are plan to organize some capacity building training virtually, it may be the different topics. Let's say it may be some extent leadership, some extent research, some extent SRAs, some extent advanced technology, AI. So what do you think? Is it good for your people? Let's say if you can arrange or organizing some volunteers. This is a completely free capacity building training to you. So trainer from the Bangladesh, trainer from America, or another African country, they can also help you guys. So what do you think? If we are organizing the capacity building training to you, is it very suitable or good from your side or not? Is it helpful for you?
Yeah, like, can you frame the question again, please?
Well, I just mentioning if we organizing some capacity building training for Kenyan people, especially the Kenyan young generation, is it helpful for you or not virtually?
Oh, okay. Oh, thank you, thank you. Yeah, I get it. Yeah, the capacity training will be so good for us as the young people, because these programs, they will focus on the developing skills and knowledge, competence among the individuals and the organizations and even the communities. Yeah, and also in Kenya, this capacity building, they will initiate and they can improve the capabilities of professionals, researchers, educators, and even the policymakers, those guys, yeah. And also by enhancing the skills, Kenya can able to address the complex and the challenges more effectively. Yeah, in short, yes, it will be of a positive impact to us.
Yeah, thank you so much. And I would like to go to Mr. Mori. Mori, you are a very good leader, right? You have a very good leadership capacities and abilities, right? So we have planned to, approaching is like that. We want to organize a webinar. This is not end. We want to explore our all the information around the Kenya and then around the Africa. We wanted to connect the bridges, right? Our main mention or main point is to connect the people and ultimately the good healthcare system around the world, right? So, Maureen, what do you think? If is it possible for you or your teammate to gaining some leadership? Let's say if we organizing some leadership training program, so is it viable to you to organize this kind of the program in Kenya and virtually? So this is and the trainer are from America, from UK or some other countries. So is it good for your site if we are organizing some leadership training?
Yeah, yeah. Thank you so much for that question. Actually, I'm so glad that you have mentioned that, because it's one of the things that actually has been running in my mind about training, about webinars, because actually uh, matters to do with research and training students is one of the pivotal roles that can help these people to grow mentally. And actually, this is where the world is going. I'll just, before I answer that question, let me just go back. You had asked Hanson, my brother Hanson from the University of Nairobi, something about research. Actually, the future of medical field up to now lies in research. Future of medical field lies in research. I've actually published like 2 papers, and from such papers, when you publish them, you get a lot of connections. You find people like looking for you. Let's do this together. Of which it has been a great opportunity for me. Organizing a webinar will not be hard, since you are here and we have connected well. Organize a webinar
Right.
is not something that is hard. It's just about creating the link, coming up with a topic of discussion. Then I let the students to join, because actually we are leadership. We're influential guys. So when I just tell them, let's join, we are going to be taught something. Yes, we are going to be taught something. They'll be so glad. And medical students here, they like research. We have research clubs. Like now, being the director of research in Africa, and actually in that committee, it will be great. Also being part of the research community in my university, it will be great. These students will feel well, and they'll gain so much knowledge from such
Well,
webinars.
so
So organize
thank you so
webinars.
much, Maury. It's really a great
Thank
word
you for
from
your
you guys. So
initiative.
we have just at the end of our session, so we have a couple of questions I need to cover. So I can go to Mr. Derek Oma. Derek, can you hear me? Derek. Well, I think Derek has some connectivity problem. So I just go to the Nelson. Nelson, you have coordinating all this. So I just back to you. Talk with the Derek. Derek, can you hear me right now?
Yeah, I can hear you clearly. Can you hear me?
Well, so the last question from my side. So what do you think, Derek? The common question, if we are connecting whole Africa, let's say we are connecting all the African people, and we just find out the common problem and addressing this to the policymaker or stakeholder, let's say the young generation, we can identify the common problem, what are the challenges, then explore it to our stakeholder or United Nations or something else. So, what do you think? Is it possible if we are working hard, especially for the research or something else? What do you think, Derek? Is it possible to connect all the African people in a single platform?
Okay, yeah. First of all, yeah, I need to say that it's actually possible through research, yeah. And then I think personally, I'm thinking of let's say, as my friend actually said, we identify a common goal, yeah, that suits, if not everyone, but most people, yeah. So let's say, for example, let me use an example. Yeah, we've been having a burden of malaria since, the 19th century, at least I can say that. And then we say, okay, this has been a burdening problem for us. So we try to dissect this topic, and then we say, okay, these are the areas that, okay, are prone to this malaria, and then these are the most vulnerable communities, this case, yeah. So after that, now we come with, uh, you know, let's say uh, like a research, plan, and then based on now our research, that means now we'll have to go to fields of our respective areas, yeah, and then we say this area, there's a burden of this kind of illness, let's say malaria, and then this place, malaria is on these seasons, of course, and then we now devise a way, and then we say at least there are some places are endemic zones of malaria. Some are seasonal, during rainy seasons, yeah, malaria are peak. So we come with a certain goal, and then establish all the way, work plan and everything. And then after that, yeah, of course, through technology now, we'll now be able to connect other regions that we can't access physically, yeah. And then we come with a work plan, yeah, a very normal work plan uh, through online meetings like this, yeah. And then we'll now say we have this problem at hand, yeah. We've identified it, and then these are the strategic plays of meeting it. So with the help of of interventions from, of course, there's a financial intervention. Uh, there's also through our leaders, we reach specific people, and then we can be able to at least accumulate all these,
Well, yeah, thank you so much,
remote
Derek.
places.
I just already received your information. So after the session, I just request to Mr. Nelson. So you just collect all the information. So I just give you to the format. So after the meeting or the session, we would like to identify what are our common problem, addressing problem, and how we can addressing this problem, and what are our next steps to continue this kind of the program around Africa. So the last question has a very good relationship, especially in the cricket, right? From the early beginnings, the Bangladeshi team always travel to the cricket for the Kenya, and Kenya is come to Bangladesh. So Nelson, say something about Bangladesh. Just say hi to my people, so that my people will be very happy because they will get some love or warm wishes from the Kenya. Say something for my people.
Okay. I think actually we met in very unfortunate ways. For those who don't know, I met Dr. Hossain from LinkedIn, and we connected on matters health. I think you have a very good initiative on matters health there with Kambaii. I want to say that I took some time to check one of the activities I've been doing in other countries here in Uganda, some other African countries, and I can say it's a very good initiative. And hopefully soon the project will be launched here in Kenya. And I want to say to the people of Bangladesh, I want to wish
Yeah,
them all the
thank you so
best.
much, Nelson. Thank you so for your valuable comments. Hanson, can you say some key words for me about my country, Bangladesh? Say hi to my people, Hanson.
Okay, so I wanna give my greetings to the people of Bangladesh and tell them we are together in this. We love them and we appreciate the support such meetings that we are having. Yeah, in Bangladesh, okay, just outside the topic, it is one of the countries that I was so eager to visit when I was a primary school kid, and I love your country so much. And all this that we are doing together, I appreciate. Thank you.
Thank you so much. Mr. Mori, about my
Thank you
country,
so much.
Bangladesh. Yeah.
Thank you so much. Actually, it's Mori, but it's Morris. It's not Mori. Thank you for that. It's Morris. Just we say hi. Say hi to your people, and we love them. We love you, and we'd like you to continue doing this. And for what you have told me, let's plan a next week of a webinar with the students from Kenya. Let's just
Thank
have
you so
one.
much, Mori.
Any,
Yeah, thank you.
just tell me when you are ready. Then we'll have it.
Last word from Mr. Derek. Any kind word for my country, and please can you please provide about how you would like to this session? Are you enjoying the session, or what do you think? This is very important, or this is not useful, Derek?
Hello. Yeah. Actually, first of all, I've really enjoyed the session. Yeah, it's been enlightening. Yeah. So, and it's an honor actually to meet people of Bangladesh. Yeah, though it's my first time interacting with you, but either way, very finally, I knew Bangladesh through some film. I was watching over there. Yeah, that was way back when I was in primary school. So it's an honor actually to meet you guys, and I'm looking forward to meeting with you in future and everything. And it's an honor also from my side. To be able to reach you out, yeah, and then you guys get along together and also incorporate us. So it's so much appreciated, and thank you.
Thank you so much, Derek, and thank you so much everyone who has joined the session. And hello, the people who are seeing the session. Thank you so much who are enjoying our session. And that brings us to the end of another interesting episode of Healthcare Episodes, Kenyan Youth Discussions by Kambaii Health. And we have heard invaluable insight and perspective from our estimated guests. They would like to shedding light on the complexities and opportunities with Kenya's healthcare landscape. And as we wrap up, let's carry forward the passion, ideas, and collective determination to drive the positive changes in healthcare accessibility, quality, and equity for all Kenyans. Thank you for tuning in, and until the next time, remember, every voice, every idea, and every action matters in shaping the future of healthcare system in Kenya. Mr. Tan, for more enlightening conversation. Thank you for joining the session. Have a nice day. Have a nice time. Goodbye from Bangladesh. Thank you so much.
Thank you. Thank you. Bye bye.
Thank you. Bye bye.